Hello, my name is Prof Betancourt. I am the Salem Professor in Global Practice at Boston College and the Director of the Research Program on Children in Adversity here. I've been working in Rwanda since 2007 and have for many years had wonderful and close collaborations with faculty at the University of Rwanda, especially Dr. Vincent Sezibera. And I've been involved in collaborative research in many African countries, including not just Rwanda, but also Sierra Leone, Uganda, Ethiopia-Eritrea border. I've also had research collaborations in Thailand, the former Russian Federation, Lebanon, and Mexico. So I'm very honored to collaborate with UNICEF for today's event. I was also thrilled to serve on the board of the recently published UNICEF State of the World's Children report called On My Mind, Promoting, Protecting, and Caring for Children's Mental Health, which calls for commitment, communication, and action as part of a comprehensive approach to improve child mental health globally. In 2004, we collaborated with UNICEF, the Mbuto Foundation, the University of Rwanda, and Nshuti Mubuzima, Partners in Health Rwanda, and the National Institute for Statistics and Research in Rwanda to conduct a baseline evaluation on early childhood development in the country to help with assessing the ECD&F program impact. Dr. Sezibera and I have also worked together to develop and evaluate the impact of a family strengthening intervention for HIV-affected children and families in Rwanda. We're now working together on Sugira Muryango, which is family-based prevention through father-engaged home visiting to promote early childhood development and reduce violence in families linked to the VUP in the country. We work closely with the University of Rwanda Center for Mental Health, FXB Rwanda, and the National Child Development Agency of the government of Rwanda to achieve our goal of scaling out the program in hopes of reaching nearly 10,000 families living in extreme poverty, especially with the focus right now on 3 districts, Rubavu, Ngoma, and Nyanza, but with hope to extend it to many more. So I'm thrilled to talk today about Sugira Muryango, how it focuses on child mental health, reducing violence, and promoting resilience for children and families. So the story of Sugira Muryango and how it came about is truly a story of empowerment. Our mission is to support parents and families by working together with parents to reduce the burdens they experience and improve their parenting skills and their interactions with their young children under the age of 3. Sugira Muryango is an evidence-based home visiting model that focuses on supporting male and female caregivers to interact with their children in stimulating ways, to engage in play, and to create a better future for this next generation through early beginnings. We focus on the family unit holistically. We enable families to reach goals that matter most to them and to achieve outcomes they find desirable. When our coaches visit a home, they encourage play between both male and female caregivers and their young children. They also work with the family to develop skills to manage strong emotions and reduce conflicts, as well as violence that can be common when a family faces extreme poverty. We focus on helping parents and children to develop the relevant psychological, behavioral, social, and character skills they need to thrive across the lifespan. Sugira Muryango has grown and improved over time, from the days of small trials and pilots to the current phase of implementation and scaling out to 3 districts. The program has really expanded in both reach and impact. Over the years, Sugira Muryango has added features to ultimately achieve its overarching goals. And the dream and vision of Sugira Muryango is that it would be able to serve many more vulnerable families around Rwanda and in other low resource settings in parts of the world in the United States, as well as other parts of sub-Saharan Africa. So when it comes to positive mental health development and why early childhood is important, the earlier we start, the better. Early childhood interventions serve as preventative measures for maladaptive outcomes throughout life. The earlier we provide support and expose children to safe, engaging, and nurturing environments, the more likely they will thrive. It is much harder and more costly to address mental health issues, delinquency, and conduct orders once they become prevalent. Holistic early childhood development programs serve as a foundational basis to propel children towards a state of flourishing and productivity, while also mitigating and preventing potential harm. These interventions are the key ingredient to helping raise resilient adults and supporting happy, healthy, and prosperous families. It is especially important for our youth to consider how they can break negative cycles of intergenerational mental health challenges and to create a better future for themselves. We also need to recognize that involving the evolving capacities of young people and listening to their views, engaging young people themselves in problem solving and community-based solutions to promote the rights of children. So how is family violence linked with child mental health? Well, exposure to violence, either directly or indirectly, is the reason for a large number of poor mental health and child development outcomes. For instance, increased likelihood of mental illness, increased chance of becoming an offender of violent crimes in later life, increased likelihood of conduct disorders, school dropout, teen pregnancy, and higher likelihood of perpetuating cycles of intergenerational violence within the household. That is just to name a few. Truly, family violence has the potential to derail a child from positive mental health over their life course. We must do what we can to protect our children from family violence and community violence to improve their overall outcomes and potential in life. So how could parents build better skills in ways that help promote good child development and mental health? Well, first of all, start early. Universal access to parenting and family support programs is key. Focus on positive, meaning reinforcing values and desired behaviors and giving children praise and encouragement. If the only time a caregiver interacts with their child is when the child has done something wrong, it is time for a change. In early childhood and throughout the life course, talk to your child, communicate, sing, and play with your children. Bath time and feeding time can be a source of fun and joy. Even as adults are doing chores around the house, both males and females, use language and engage young children in a playful way so that their brains can benefit. I'd also like to recommend that we be more open with children and have age-appropriate conversations about all topics. For example, do not avoid topics such as sexuality and making good choices about your body just because they're uncomfortable. Learning new skills together are great ways to build better early communication. Plus, positive memories are great for improving mental health across the lifespan. So how can families make the home a better place for children to grow? Provide safe, engaging, and nurturing environments. Play and interact with your children as much as you can and set realistic expectations. Plus, focus on positive disciplinary strategies and positive outcomes and reinforcement. And of course, practice parental self-care. Take care of yourself so that you can do well in taking care of your children. More than anything, I encourage us all to think deeply on what families and home mean to us. Whether we are parents, caregivers, or others, we might not all be parents, but we have a part to play in supporting the current generation and raising the next one. Our understandings of families are evolving, so too must our approaches to creating better, healthier, and happier homes. We are all in this together. So what are some key lessons from Sugira Muryango that can be shared with other organizations and individuals working to support children? Firstly, focus on the family and holistic development. Focus on male and female caregivers and all the others involved in the care of children and in promoting their mental health, including grandparents, neighbors, coaches, religious figures, and peer groups. Secondly, building strong systems to support children really matters. Improving mental health and improving early childhood development does not happen in a vacuum. Sugira Muryango focuses on helping parents develop a strong support system that truly leads to a happier family and navigating both informal supports around families, but also the formal systems of nutrition, education, and health. Finally, be resilient and maintain motivation to make the world a better place. One thing we can take from Sugira Muryango is a continuous effort to improve the lives of children globally. When you hit obstacles, rely on your networks, your communities, and your role models to keep the effort going. The world needs more individuals and organizations who are devoted to supporting children. The world needs champions for mental health. So what would be my message for World Mental Health Day? Mental health is fundamental to overall health. We must take our mental health and development just as seriously as we consider physical health. We must do more to align our ambitions as researchers, officials, and citizens alike to support initiatives, programs, and awareness pertaining to mental health, especially the mental health of children and youth. It is important for all of us to talk about mental health and to prioritize our own, plus supporting those around you who may need some extra help. The journey to better mental health starts with us. So I'd like to wrap up by highlighting the importance of UNICEF recognizing the need for improved child mental health and this wonderful day that you're all embarking on. If the past year and a half and the global pandemic has taught us anything, it is that life is precious and we must do what we can to live a happy and healthy life, and that starts with our mental health. So take care of yourself and take care of others. Thank you all for your time and attention today.